Hi and Assalamu alaikum. My name is Dr. Maheen and I am the Manager Corporate Communication at the Y.BK. The Y was founded by Furqan Kidwai in 2014. It's a leading health tech brand in Pakistan. The company has spearheaded many initiatives, which include medicine delivery, teleconsultations, provision of nurses and physiotherapists, dental treatments, at-home COVID vaccinations, and samples of comforts of your home. Um, the recent surge in the technological literacy in Pakistan has aided, supported, and boosted the Y to champion consistent innovation in the healthcare sector. The Y aims to make healthcare authentic, affordable, and accessible. Health literacy is one of our core mandates, and we take pride in enabling patients to make better health choices. Today, the topic for today's webinar is how can improved nutrition decrease the burden on healthcare systems in developing economies. We have some of the market leaders who are going to share their perspective on the topic. I'd like to introduce I'd like to state a few facts about the topic, after which we can introduce everybody and we'll start. According to statistics, early interventions around nutritional awareness and consumption is necessary for the holistic growth of an individual. So in Pakistan, over 12 million children under the age of 5 are stunted and over 2.2 million under the age of 5 are wasted, as there's a lack of nutritional awareness and access in early childhood development for low-income communities. Pakistan has one of the highest malnutrition burdens in the world. Stunting, wasting, and micronutrient deficiencies are endemic. Diet is the number one risk factor in worsening the burden of diseases and is a central driver for all forms of malnutrition. Poor diet does not just cause micronutrient deficiencies, but also obesity, whose levels are rising from 18% in 1999 to 29% in 2016. I'd also like to introduce our speakers for today. So we have Miriam Schindler, who is the program lead, children and young people at the Global Alliance for Improved Nutrition. We have Chaudhry Faiz Saab, who's the Senior Policy Advisor for Global Alliance for Improved Nutrition Pakistan. We have Huzaifa Ahmed, who is the co-founder of RISK, which is a social enterprise working on channelizing food-based philanthropy. We have Priya Prakash, she's Act for Food, Act for Change youth leader, and Sarim Raza, the UNCTAD Youth Action Hub coordinator, Pakistan. I'd like to welcome you guys. Thank you so much for being here.
Thank you.
Thank you.
Is everyone able to hear me properly?
Yes, we can.
Perfect.
Yeah,
okay.
very well.
So my first question is for Miriam. Miriam, could you tell us a little bit about the work that GAIN is doing and how does GAIN's work on a global level impact food systems?
Okay, first of all, thank you very much for having me here today. Good morning, I guess good afternoon for you. Thank you, Dr. Maheen. Yeah, thank you, Devai, for welcoming me to this webinar. So just to give a little bit of an introduction to GAIN. GAIN is the Global Alliance for Improved Nutrition. And this year we're going to be celebrating our 20th anniversary. So GAIN kind of operates on a global level, but we also have offices in 9 countries, of which one of them is Pakistan. And my colleague Faiz from the GAIN Pakistan office is also one of the speakers today. So GAIN, when looking at nutrition, we look at food. So if you think you talked, Dr. Maheen, about malnutrition. We talked about the high levels of malnutrition in Pakistan, undernutrition, micronutrient deficiency, but also the increasing obesity levels. So if we think about poor diets being a contributor to malnutrition, GAIN looks at how do we improve people's diets. And yes, we talk about health literacy. How do we help people to make better health choices and make better food choices? But it's not just about consumers and the ability of their choices that they make. So GAIN also looks at how do we make food more available? How do we make food more affordable? And then really focusing on that last bit of how do we make food more desirable and how do we support people to make better health choices? This morning, I was just reading, I don't know if anyone saw in Kenya, food prices have been increasing rapidly. And really what that will do is that will cause malnutrition rates to increase if people are not able to be getting the food that they need, if they're not able to afford it. But why I thought this was interesting and kind of I wanted to bring it as an example, because it shows that like food systems don't operate by themselves, and we need to be thinking across sectors. Why is the cost of food going up in Kenya? It's because of trade. It's because of the cost of fuel. It's because the ability to people to be able to access markets. So GAIN really takes this perspective of looking at across the sector. How do we think about how food interacts with health systems? How do we think about social protection systems? How do we think about education as well? So I think it's really important for me, and kind of this is GAIN's work on a global level, but also on a country level, that we don't take a siloed approach. When we talk about improving diets, it's health literacy, but it's also looking kind of at value chains. But we also consider about how food interacts with other areas as well. So today, when we look globally, it's about 1 in 3 people. So this is nearly every country in the planet. People are not able to consume enough nutritious foods. And this puts heavy burdens on health systems. So I'm from the UK, I live in France. In the countries where I live and I'm from, we really would look at the biggest form of malnutrition is obesity. And I think it's really important that we look at this as a form of malnutrition. And so if you think about what this will do to health systems, it causes burdens in terms of increasing obesity, increasing things like diabetes, non-communicable, other forms of non-communicable diseases. And so GAIN really, as I said before, kind of looks at that diet to improve nutrition outcomes. So I kind of wanted to come back also, Dr. Maheen, to one of the points that you were talking about before, about how do you support people to make better health choices? So I think, there's one area where you look at how the affordability and the availability of food, but it's also how do you make food, good, healthy food, desirable? So I think the first thing that's really important to consider is if we think about governments, nutrition isn't always on the top of governments' agendas. And if it is, it's also difficult for governments to be able to kind of influence people to make healthy food choices. Businesses shape a lot of what we eat. So I would just say to all of you today, like, think about how many different products you've seen today, like where you've seen them, the type of foods that have been marketed to you, and kind of what's been like influencing the food that you want to be eating today. But our behaviors are also heavily influenced by our cultures and our traditions. For those of you in Pakistan, you will have a completely different perspective on culture and tradition relating to food from what I have. Last night, I was having dinner with a French friend who asked me about eating snails. And I don't know if you're aware that eating snails is quite common in France. And my response was like, that sounds absolutely disgusting. But they're a nutritious food. They're high in protein. There's nothing you would do to get me to eat a snail. So I think it's very important that when we think about health literacy and we think about how we can kind of support people to make better food choices, that we're also thinking about people's cultures and traditions and how much that also influences the food that they're eating. So I'm gonna stop there. Just a few points from me. Back to you, Dr. Maheen.
Thank you so much, Miriam, for your insight. You're absolutely right, actually. You can see it a lot. And so you know how you're mentioning a friend eating snails. Similarly, this morning, there's all these billboards when I drop my kid to school. And the first thing that he mentioned to me was that, I want to eat this cookie just because, it's about action heroes and how they're able to fight and they have so much strength, and it's everything that's sort of that's associated with the kind of marketing that we do, which influences the choices that people make. I mean, I'm an adult, right? And maybe it's easier for me to control my urges, but when it's down to a 3-year-old, it's almost impossible to explain to them why they're marketing something and why it doesn't work that way, and why that may not be the right food choice. But I mean, it's unfortunate, but I really hope that sessions, like the one we're having right now, could maybe, change the way people look at nutrition. And also, thank you for pointing out the fact that malnutrition is not just somebody being underweight or malnourished. It has a lot to do with obesity. So thank you, Miriam. My next question is for Faisal. Fessa, what are the projects and initiatives that GAIN Pakistan is taking to improve how food systems are operating in Pakistan?
Thank you, Mahin. Mahin, before going to directly give you a list of the projects on which we are working in Pakistan, I think building upon the comments which Miriam has made, she gave a more global perspective. A few areas on which gain not only globally but in country how we are designing and how we are transforming to set our approaches to address the malnutrition not only globally but also particularly right now as we are talking about Pakistan. So how we are transforming our approaches in the context of Pakistan's malnutrition situation. And for all of this scenario and situation, we are building upon the global scenario, where we used to say and we always mention that more than 3 billion people they are not affording, they are not getting the healthy diets, and health. The concept of healthy diets it has been evolving, but I would say. And if we look into the figures, again, hunger, there are two different concepts and perspectives if we think about diets and food. Either it's nutritious and it's safe too. So having two different perspectives, safe and nutritious, will complete the concept of food which is required by our bodies. So under this context, I would mention first of all how GAIN is designing its approach at country level. Number one is our global and in-country priorities and strategies. Our country priorities and strategies are directly linked with the country priorities wherever GAIN works. So giving you an example on Pakistan, where we are facing one of the very serious situation of malnutrition. If you go into some kind of figures and numbers, around 40% of our population they are not getting the right food what they want, what they need to eat, unfortunately. And our almost 4 out of 10 women in Pakistan they are anemic. And if they are anemic, we do have certain root causes, and those have direct linkages and relationship with the malnutrition. Unfortunately, more than 16% of our population are severely food insecure. These three kind of key indicators are reflecting on our population, and that's why we say that 40% of our children are stunted, unfortunately, and around 29% of our children are underweight. On the other hand, our half of our population of children under 5 they are anemic. And this is you can imagine all of our colleagues and the audience here how the global malnutrition and food insecurity are affecting the national figures, and how national situation really coming down in the shape of these kind of serious malnutrition situations. So I think the last year, which was the we used to say the year of food system 2021. So under that, one thing was very clear understanding and visualize that having all of these challenges, we do have certain opportunities also. And when we think about these opportunities, I'm coming down now about GAIN, how GAIN has designed its programs in Pakistan. There are three key areas those have been highlighted during the last year. And to give all of the colleagues here a quick highlight and the quick orientation, what have been doing and what GAIN and other colleagues, other partner organization and stakeholders have been doing during 2021. We had almost 15 national and subnational dialogues. These were high-level dialogues, and we engaged more than 500 high-level experts, not only from the public sector but from the private sector, to really have a deep dive into the current malnutrition situation of the country, and what are the root causes and what are the key logics behind why we are not achieving. Particularly, if we think about the SDGs, we are far behind to achieve the targets which we have already set for 2030. So having all of these areas, there are three key priorities, but we are working under that. One is the food supply area, second is the food environments, And finally, the valuing our food is the most important area under which action to motivate and empower and enable everyone so that they can get the healthy and nutritious food. So I would like to mention here how GAIN defines the safe and nutritious foods. So a food is a food that is in the context where it is consumed and the individuals those consume these foods, it provides the beneficial nutrients to those consumers. So this is a very simple definition, and we used to say this is a gain definition about nutritious food. On the other hand, about the safe food, so as a food that does not increase the probability of poor health outcomes in our population, that could be considered as a safe food. So having these situations, coming down to some figures, what we have right now in Pakistan, by 2020, our population was around 215 million, and it will be more than 350 million by 2050. And the food requirement for this population, it starts from 75 million metric tons. And by 2050, the food requirement would be 130 million metric tons. So this requires two kind of efforts. One, how the Pakistan, how the policies those can address the challenges on nutritious food at one end, on the other end, how the challenges on the food safety can be addressed. Do we have the policies available in the country? Are these policies are really being implemented? And finally, do we need to further touch and have some kind of reviews of these policies? So these are our priorities these days based upon our work on food system, on which Miriam has also touched up few points, and I will fully focus on our approach towards food system. And under that approach, I think a very serious situation what we are working right now with different ministries. If we talk about Ministry of National Health Services, with Ministry of National Health Services, our focus is more on food standards and particularly to address the NCDs, non-communicable diseases. And if we think about the food challenges, food diversity, and these kind of areas, we are directly working with the Ministry of Food Security, Ministry of National Food Security and Research. Those are directly linked with the food production, particularly in the agriculture context. Food diversity and the yield about different food items, like in Pakistan, we have wheat as a staple food. And under these areas, if we link up these current situation, working with Ministry of Food Security under food production, working with Ministry of National Health Services with on fighting with NCD's current scenario, and finally working with Ministry of Planning and Development to review the existing policies and plans, what we do have in the country, and what kind of further tweaking these policies are required into these policies. So in future, in the next couple of years, we have two clear-cut focuses. One is on the Pakistan National Food Security Policy. We need to work with the Ministry of National Food Security and Research, and we have started some kind of scoping exercises and scoping work on that. In addition to that, we do have with Ministry of Planning and Development, we have a scaling up business network. And this is one of the networks what Sun has in country. Scaling up nutrition do have 4 different networks, and out of them, one is the scaling up nutrition business network. And this business network directly help out the businesses how they can really improve their contribution to improve the national nutrition scenario. And in addition to that, GAIN is directly engaged, and we have been working since long. And food fortification is and has been a flagship program for GAIN. And for this, we have been working, and we still are engaged as a national stakeholder advisory board, advisory member with the Ministry of National Health Services to provide all the advisory services to the ministry to deal with the challenges on food fortification. And I hope we are well aware about the food fortification. This is one of the most cost-effective approach to address the malnutrition, particularly the key areas of, as I mentioned earlier, iron deficiency, starting from iron deficiency to vitamin A deficiency, going to the zinc deficiency, and further, in addition to these deficiencies, we also need to think, and we are working with industry to address the challenges on vitamin A and D deficiency, which is directly linked with the availability of oil and ghee to our masses in the shape of fortified oil and ghee. So, having these clear-cut areas of focus in front of us, what I will mention here broadly in a way that our next couple of years, I would say the next 3 years would be more focused on policy perspective. What are the key gaps and key challenges and key kind of uh, hurdles are exist in the country to implement the policy? First of all, to visualize the consumer-friendly policies, how GAIN can assist Government of Pakistan, how GAIN can work with the relevant authorities, including the provincial food safety and quality authorities like in Punjab, PFA and KP. In KP, we do have uh, provincial food safety and halal food authorities. Same we have in Sindh and other provinces. So we are directly linked with these authorities. In addition to these, we are also working with, as I mentioned earlier, with the Planning Commission to review certain policies and plans so that we can help out our policymakers to provide them the data. And under these data aspects, my last comment would be GAIN is directly linked with the Ministry of National Food Security and Research to develop a national level food system dashboard. This dashboard will be getting the sub-national data from provinces and grassroots level of districts and cities. But this will really give the policymakers some kind of very clear direction how to how to define and drive the policies towards a situation where we can make sure that our population is getting safe and healthy diets in different contexts we have already discussed. Thank you so much. Over to you.
Thank you so much, Vesab. Thank you so much for the insight. And it's good to know that, even at a national level, there is work that is being done, very active work that's being done to, fix this nutritional deficit issue. Also, I think one thing that we could really maybe focus on, at a national level is that maybe there are certain organizations that are trying to, like Miriam said, make healthy food more desirable. But I really hope that that is something that more people would probably look into in the near future, where they try to make healthy food more desirable, especially for I think the younger generation, because that is where it all starts. So I really hope that we're able to, and your organization is able to take the steps necessary to fix issues at the grassroots level. Josefa, my next question is to you. Can you tell us a little bit about the work RISC does and what problems are you trying to solve?
Uh, Thank you, Mahi.
Hi, Josefa.
I hope everyone can hear me. So thank you for all the speakers on the panel. They're doing some amazing work in their respective fields, and I belong to the same industry, solving somewhat similar challenges that we are facing today. Um we at Risk initially started to solve one of the very basic concerns and problems that we're facing in Pakistan, that was pertaining to food wastage. So we were one of the only organizations and still are who are trying to build up on an urban model which can help us to reduce the food wastage. So we deploy different methodologies. We develop our own food banks for this purpose. Where this is a pilot program. So initially we started, and uh, after so many years, we've been trying to get into the system, and a few failures and few successes. But here we are right plugged into the system of in urban communities trying to develop food banks. So food banks are somewhat facilities. Then the concept is influenced by the food banks in the West, but these are localized versions of those food banks where the food is being sorted and then pre-packaged and then provided to different people, different organizations, different communities which are in need of food, right? So people, the food communities, we get requests from food insecure communities, people who are living below the poverty line, people who are having children in their NGOs, some orphanages. So these are the kind of uh, uh, organizations that are in need of food. So this is one of our main programs. And apart from these programs, we have developed 2, 3 other programs as well, talking about strictly about nutrition and accessibility to food. So we are working on 2 to 3 main domains. One of them is how we can reduce the food wastage of Pakistan, the 40% of the food that is wasted. So that is from the entire supply chain, not just the urban markets. We still have to cover the grounds on the farmer side. So we are only in the suburbs of urbans right now, but we plan to go to the farms as well in the upcoming years. The other program is pertaining to accessibility of food, where we develop a subsidized ration program that is targeted to the marginalized communities. We've developed a system which helps us to identify the most marginalized segment of the society, and we provide to in order to fight the inflation and rising prices. So we try to provide them with subsidized food grocery packages for the entire month. So these are the people who are below the poverty line, and they've been done multiple checks on their poverty, on their eligibility, and then they're issued a card where they can access these cards right now from their nearest food banks in the communities, and later on we have a few other distribution models as well, where they can just get take these cards to their local grocery stores and just scash these cards and get the groceries they want. So we are also planning to include a nutritional element in them. We are already piloting how we can fortify these grocery bags for them. We've also worked with Gain in this respect to cover the fortification part of our ration program. So this is one program. The third program that is now facing up in our domains right now is how do we provide safe and nutritional meals at a very low price to the largest to the BOP, the bottom of the pyramid segment of the society. So for that purpose, we are developing industrial kitchens in the heart of the city. So one of them is almost ready in Lahore. So the purpose of those kitchens is to provide through economies of scale. So we try essentially are trying to prepare very healthy meals. So when I say healthy, I literally mean that we are using different sort of oils that are very safe for health. We are using spices which are organic, which are procured from farms. We are using products which are we are the ingredients, the mix of ingredients, not only the recipe. The taste is given priority. The priority is how the nutritional element of that the product is can be maintained. How we can use the wheat atta to procure those rotis for those people, and then subsidize that food. So the labor class, the rickshaw drivers, the laborers, the daily wages can have access to those outlets. So these outlets, you can imagine them as very fancy built carts, which are operated just like a franchise, which are operated in different areas. Two of them which are deployed right now. One of them is out. Two of the public hospitals. One of them is outside Shawat Khanam. The other one is outside Jinnah Hospital, and we are scaling up to 5 in the first pilot phase, and then we have to develop in Lahore, Karachi, and Islamabad. We plan to open hundreds of them, which will eventually provide accessibility to cheap and nutritional and hygienic meals. So, as as Miriam also mentioned and Faisal also mentioned, there is a greater lack of accessibility of not just only meals, nutritional meals to those people. So many people are not just focusing how we can give access to the marginalized community who is fighting inflation right now, is fighting the hikes in the prices. So this program is actually focusing uh, to create that chain of restaurants which are providing. You can just imagine them as McDonald's for these segment of the society, highly standardized meals, but really nutritional at a very cheap price, so that their dignity is maintained and a larger audience can come to these outlets, give the price, and sit and have a good, decent meal at a very good price. The putting a price to these is just to make it more dignified for these people, so that a larger audience can be catered, and in the long run, how we can reduce our cost and make it sustainable by making it a business oriented model. And these two models are these three programs actually are right now going in a lot of priority at risk. And over and above that, we are developing a platform that is focused on creating a community that believes in sharing, their beliefs in compassion, and how we can use that platform and technology in order to create advocacy around SDG 2, 12.3, about wastage, about responsible consumption, about nutrition. So we've so far been very successful engaging a lot of university and school chapters around Pakistan. We've got a huge force of volunteers that is now engaging through the platform. They're talking through the platform. They're donating through their time. They're volunteering their time through the platform. And the whole idea is how we can enable a very responsible community on that platform, which is talking about food security, which is talking about hunger crisis, hunger problems in these areas, and they're actually taking ownership of this problem in this country, and how then we can scale this problem to other countries of the world, especially the hunger stricken, the refugee stricken crisis areas where we can deploy technology and establish any of our programs which are suitable for those regions. So this is what we are doing at Risk, and this is how we plan to go. Thank you.
Thank you so much, Zephyr. Being a part of the startup sector, I was definitely answer my next question to you, which was how is your model sustainable? But I think you've sort of answered that for me already. But I think it's great work that Risk is doing, and I think you're the pioneers in the food sector, and you're doing amazing work. I, in fact, had a chance to hear you speak at one of the conferences that was held at Karachi University. I think it was a GAIN conference, and Sarim and I were a part of it. So we didn't get a chance to meet, but we did get a chance to meet your partner, and got some insight into the work you're doing. So kudos to you and good luck. I really hope that more people sort of get inspired by the kind of work that you guys are doing, because it's very purpose driven, and sort of start focusing on that part of that part of the sector. So thank you. Priya, my next question is to you. So can you talk about the global Act for Food, Act for Change movement, and what are the efforts that are being made in your country?
Sure. Thank you so much for having me on this panel. It's actually amazing to be here and, of course, interact with all the food leaders in the country and, be at the same level as them. I think it's amazing that young people are given this audience and are included in a lot of these conversations. So just taking in that theme, with the Act for Food, Act for Change movement, it's a global food-based movement. And what the movement really believes in, and what I personally believe in, is that as young people, we are doers. We really want to take action on various things that are around us. We take accountability of a lot of issues that are happening around the world right now, and we try to see what changes we can make at our own local level. And 2020, sort of kick-started this entire decade of youth activism, as I would like to put it. In fact, today, all of us who stand up for a cause are, in a way, activists of those particular things that we believe passionately about. So a lot of young people around the world are actually rallying for different SDGs, whether it's good health and well-being, whether it's zero hunger, all those causes are so important to all of us as young people. So for the Act for Food, Act for Change movement, it's actually very similar. It's a global movement that is based around the food systems. It's for the young people, to actually promote governments and businesses to take the right actions and to have youth at the center of a lot of these discussions around food systems. And it's to make everyone in the ecosystem, which is a multi-stakeholder ecosystem. All of us are part of the food systems. I think it's a multi-stakeholder problem, whether it's businesses and startups, or whether it's governments, whether it's policymakers, civil society, everyone has to come together. So it's about getting everybody together to make a pledge to transform food systems, to make them a lot better in the coming 10 years that we have to achieve the SDGs. Of course, now it's lesser time that we have, but really pushing that pedal on making sure that this is done. And a lot of young people actually from around the world came together for this movement in different countries. We had a lot of young people who were already passionate about it at a local level. Like, for example, I was doing a lot of work in India in the field of health and well-being, right? And that's when I got to know about the Act for Food, Act for Change movement. So it brought together people like me, people like Sareem, a lot of people from around the world in different countries, so that, number one, if you're doing something that you're passionate about in your country, you don't have to feel alone, because sometimes changing things or transforming things, whether it's through the route of a startup or it's through the through the route of activism on governments, it can seem like, I'm doing it alone. There's nobody around me who's sort of
It
doing
can
this
feel very lonely. Yeah,
very
yeah,
lonely, right?
absolutely.
Yeah. So of course, at that time you feel like, okay, who's the other person like me who's doing the same thing? And so for us to connect with each other and to get inspired by each other, and to see, okay, fine, this is what's happening in Pakistan, this what's happening in India, this what's happening in the Philippines. So you get inspired, you understand new concepts, and at the fundamental level, all of us are working for the same thing, which is better food systems. And in a way, because of the pandemic, we were able to connect globally, instead of, like you said, physically meeting up. I think the fact that I'm on this panel is because things are now all virtual and global, right? So the Act for
Yes.
Food, Act for Change movement has, there's a website. If there are any young people listening, and even if you're not young, because and you're young at heart and you support, the youth causes, I think you can always go to the actionsforchange.org or actionsforfood.org websites. There's a lot of information about how you can become a youth advocate yourself. So I'll give an example. I myself am part of the entrepreneurial startup ecosystem here in India. I run an organization called Health Set Go, and for the last 5 years, I've been working with schools and universities in India to promote health and well-being. So we do a lot of school-based health programs, providing health education, access to healthcare. And honestly, it was a very lonely pursuit for me. So when I actually got an idea that, so many other people are doing this, and I shared how, for example, in India, we are trying to educate children through schools. I think there were other country leaders who got inspired by that. In fact, we had a great opportunity to work with the Gain India office as well, to take that up as a mandate, and spread that awareness among schools in India, get young children. For example, we had anywhere from 10-year-old kids to 17-year-old sort of school age kids really becoming sort of activists themselves. Because these days, to be honest, it's all about young people's voices rising up. So there was a lot of support from the movement globally. So what I would say is that this is a movement for everyone to be a part of. You can definitely be part of it if you're doing your own thing, in your own local communities. This is something which will help you amplify the work that you're already doing. Again, I'm on this panel also because I'm part of this global network. So there are a lot of opportunities. It's completely sort of voluntary, and it's something that I would really encourage any youth activist out there or an ally to the youth cause to be a part of, for sure.
Thank you so much, Priya. For you're right. You're right. Absolutely. I mean, the loneliness is one part of it, but also that's when you also sort of start to realize that some of these problems, in fact, most of these problems, are very shared. So a lot of the problems that you're talking about, and it starts right down to the level of health awareness, and making better health choices. And I think once you enable the youth, then there's no stopping it, because that is that's the next generation that's going to sort of lead, and that's where we need to make the changes. So thank you so much for your insight. My next question is to Sarim. Sarim, how do you see the Act for Food, Act for Change movement being translated in Pakistan, and what are some of the projects that are there in the pipeline?
Thank you so much, Maheen. So I'll start off by the essence of the movement in Pakistan and how we envision it. So I personally believe that there are three kinds of people in this world. There are good people, there are bad people, and there are spectators. And most of us are spectators. We see good things happening and we see bad things happening, and we just spectate things. So the Act for Food, Act for Change movement in Pakistan essentially wants to turn these spectators into agents of change, who are advocating for food system reforms locally and globally also. So that's how I see the Act for Food, Act for Change movement in Pakistan. As Priya said, it's a global youth-led movement working for food reforms on a global level. We want to bring the movement to Pakistan, turn spectators into agents of change, and we also want to democratize the movement. So what we want to do is we have a pledge that essentially allows people to pledge that they're going to advocate for food system reforms. So we want to make the movement a democratic movement. That is something that we don't see a lot of in Pakistan, democratic movements taking place. So that is something that we want to do. We want to turn spectators into agents of change through a democratic movement, but we don't just want to stick to advocacy. We want to have some impact on the ground also. So some of the things that we're currently working on, and as Miriam also said that, and it has been from the start also, in Pakistan has the highest rate of stunting and wasting in the world, one of the highest rates. And we see that as a problem, and that is something that we want to address firstly through the movement. And the primary way we are doing it is through an awareness campaign. We have designed a workshop that we're implementing throughout major cities in Pakistan. We have already executed our first workshop in Islamabad. We plan to scale that workshop into creating awareness regarding good nutritional habits in school-going kids. That's awareness, and we want to extrapolate the same project and work on access and affordability for nutritious food for school-going kids. So we're starting to solve the stunting and wasting problem through first creating awareness and then extrapolating to access and affordability. That is something that is in the pipeline that we're working on. The second thing is that we want to work on advocacy on a policy level. So we want young people to work with the government and tell them that this is the kind of systems that we want, and this is the kind of change that we want in our food systems. So that is on the mandate also. And the third thing that we want is so one of the most overlooked things about food systems, especially in developing economies, is the people who make the food. And that is something that we plan on working on. We see that the present food systems in Pakistan have their supply chains are very exploitative, and we want to work and advocate for more equitable supply chains in the food ecosystem, hence allowing smallholder farmers to increase their incomes, and that is something that we want to work on. So we are working on stunting and wasting as the mandate, but on the long term, what we also want to work on is that we want to work on creating the making the supply chain of food systems in Pakistan more equitable. And I think Hudaifa also discussed that also, because that's a huge problem in Pakistan, and that's a problem in most developing economies, that the middlemen in these supply chains takes a huge chunk from smallholder farmers. We essentially want to challenge that and work on policy advocacy tools that help prevent this from happening. So that was a short overview of what we plan to do in Pakistan. We are really excited about how we take this forward and the impact that we create.
Thank you so much, Sarim. So, I mean, you talked about the work that Food Act for Change is doing. How do you feel like, so, you know, how you're saying that you'd like to work on the supply chain issues and be direct with the farmers so that you, sort of remove the middlemen from the entire chain of command. So now, if you were to do that, how long do you think that should take, considering that, this is how things have been going on for a very, very long time?
So I say this a lot, that you got to start somewhere, right? So if you see the problem is too huge and you just tie your hands and you say the problem is too huge, you're never gonna get there. So we understand that the problem is huge, but we also acknowledge that we need to start somewhere to make actual change, and that is what we're willing to do.
No, but I mean, it's amazing the kind of work that you guys are doing, and good luck to everybody. And I can see, so Naina was the one who sort of connected me with everybody and arranged this session for us today. So I'd like to thank her. She's not a part of the session, but I'd really like to thank her. She's probably watching right now. And thank you so much, everybody, for being here. It was amazing. I think that. We've discussed some very, very valid points today, and certainly improved nutrition will decrease the burden on healthcare systems. I just hope that you're all getting the kind of support that you need from your governments and policymakers, and everybody, all stakeholders related to this cause. It was lovely chatting with you. Thank you so much. I really hope that this is first of the many conversations that we can have.
Thank you.
Thank you so
Thank you.
Thank you so much.
Thank you so
Thank you,
much.
guys.
Bye.
much. Bye.
Bye bye.